Today we have a very special guest, Dr. Tara Griffin, with us. Dr. Griffin, how are you today?
Wonderful. Thank you for having me.
Well, finally we got this scheduled, and rescheduled a couple of times thanks to Mother Nature. We want to get started. We have a lot to cover. You and I have had a number of conversations on this topic. I'm very excited that you're here and that we can finally share this with people here and with people online. Tell us a little bit about you, your history, and how did you get to do what you do today?
Yes, I am a dentist by trade, and I have a Diplomate status with two different organizations, the American Academy of Dental Sleep Medicine, as well as American Sleep Breathing Academy. And I solely focus on airway and sleep breathing disorders for children and adults. So my journey started actually down the sleep path about 14 years ago. 2010 is when I first discovered the area of dental sleep medicine. And honestly, it was because of my own health issues. So I was about 4 or 5 years out of dental school. I owned my own practice. I was very busy and typical, young female, started having a lot of headaches, head and neck pain, jaw issues, back pain, a lot of daytime fatigue, starting to wake up during the night. And I was just blaming all of that on being a dentist and owning a practice, and it was normal, right? And I discovered a doctor in a course back then, Dr. Dave Singh, who actually was teaching about a certain type of oral medical device or dental device that could actually help address the root cause of these issues that I was having. So I learned from him, and I thought, well, let's see if this works. And basically, the avenue that I had been faced with before that was the fact that everyone I went to told me I needed surgery. Surgery on my jaw to correct my bite, surgery on my sinuses because of all the chronic sinus and allergy issues I'd had my entire life. And because of that, so many rounds of antibiotics. It was sinusitis, bronchitis, colitis, the whole system was messed up. And the only answers that I was getting was surgery and medication. And in my gut, I thought there has to be a better way, and thankfully there was. So I basically treated myself to overcome those problems, and that changed my life because I realized immediately that what my purpose was, why I'm here, what I'm supposed to be doing, and it's been extremely fulfilling ever since.
Thank you for that background. So there's a lot to tap into there. I want to get started with just having you explain the difference. There's a lot of popularity these days, I should say, between in the topic of sleep. Folks like Matthew Walker have done a lot of good work with his books and how vocal he is about the importance of sleep. In fact, he talks about it's no longer a triage between sleep, nutrition, and exercise. Sleep sits on the bottom, all by itself, and the other two sit on top of it, right? But you're not a sleep doctor, right? You work within a segment of that, right?
Yes.
Could you expand on that, please?
Yes. So again, as I was saying, I'm a dentist by trade, and I have advanced studies in the area of dental sleep medicine, basically, which is expanded into the sleep field in general to learn more about the different types of sleep disorders and everything. So what I do is I work very closely with sleep physicians to diagnose the problem because primarily we're treating sleep breathing disorders like snoring, sleep apnea. Those are more common things that we're addressing with oral medical devices, basically mouthpieces. But as a dentist, we can't diagnose sleep apnea, so we work with physicians that actually diagnose the condition. However, we can screen and test, and so we do a lot of that. And with that collaboration, our angle is if a patient has obstructive sleep apnea or head and neck pain, migraines, all these other things, they may not be actually apneic, but if they have something that we can address like that, we're the alternative solution basically to CPAP and surgery and pharmaceuticals a lot of the time. So we really focus on addressing the root cause of people's sleeping issues. And again, whether that's through addressing the facial structures over time and helping expand the jaw, open the airway, really address the root cause of the issue, and or the gut biome. We focus a lot on that as well too. So that partnership works out extremely well, because without that, people are typically driven towards CPAP and surgery a lot of the time. There are other therapies, obviously weight loss and oral myofunctional therapy and some different things that can certainly help improve things, but especially when it comes down to obstructive sleep apnea, typically what's happening is there's an obstruction of the airway somewhere, and that's what we're trying to address the root cause of.
So there seems to be, at least from my point of view, I have my own history with sleep breathing. At one point, I was told I had sleep apnea, and I tried the CPAP machine, and it didn't work for me. I was actually sleeping less. It seemed to me very intrusive, and I could never relax. So I started doing a lot of similar things, experimenting on my own. I still need to come see you, because I haven't figured out exactly what was wrong at the time, but I did lose some weight, and then I started using a mouth tape. And that took care of, at least from superficially, the issues that I was having. It seems like in the general population, people don't realize the importance of breathing properly while sleeping. In fact, I've actually asked around. Most people that you ask, they think they're having good quality sleep, or that they think they breathe with their mouths closed while they're asleep, right? And in reality, that may not necessarily be the case. So what are some of the things that get in the way of someone breathing properly while sleeping?
There can be many things that can be affecting that. The nasal airway is a big part of that, the sinuses. When we see a patient, we evaluate with a head and neck exam, but also a head and neck CT scan, and also a rhinomanometry or functional nasal breathing test. And so we see the nose being the problem more than 70% of the time. And that's just restriction. It could be deviated septum, bone spurs, sinus inflammation, just allergies. Florida's the #1 state in the country for allergies, and so we have other methods, again, that are non-surgical to help to address those types of issues. But the nose is often one of the bigger parts of the problem. And so that's the first thing that we're looking at on that CT scan, from the tip of the nose to the base of the tongue, where those obstructions may be occurring. But you're right, there are different things that can benefit, and so not everyone may need an oral device. We have other therapies as well too, but people don't realize snoring is not normal. When you're sleeping, it should be quiet. It should be slow, deep, through your nose. If we're mouth breathing, it's not healthy for us whatsoever. So nasal breathing is really the healthiest way that we can breathe. And our nose needs to be clear to be able to do that. So there's a nasal hygiene process that people can use with some natural nasal sprays, like clear nasal spray, before bedtime to keep their nose open. Because what happens is during the night, you may start off breathing through your nose, and then your mouth drops open, and as soon as your mouth drops open and your mouth breathing, your nose stops working, and it typically doesn't go back the way that it was the rest of the night. So when you wake up with a dry mouth, that's a common symptom that you're going to be mouth breathing. Your nose may be stuffy in the morning, that type of thing. So really addressing it. And you mentioned mouth tape. Mouth tape is wonderful. I use it almost nightly myself, because again, after going through the treatment, that's one of the questions people often ask is, do you have to wear something the rest of your life? And with me and the type of treatment I chose, addressing more of the root cause, I don't wear anything typically. But at the same time, just helping train myself and for my mouth to be closed at night, a little bit of tape can work great, just right over the middle here. But one thing about that is that I don't randomly tell people to tape their mouth shut at night. Unless you've had a sleep test and you know what's going on. If you have moderate to severe sleep apnea and you're taping your mouth shut at night, that could be dangerous. So I don't just openly say to do that unless you really know that, you can breathe easily through your nose. You're not having the key symptoms of apnea.
So I cannot self-diagnose. I need to come see an expert. I need to come see you so we can figure out what's really the source.
Our motto is don't guess, just test. And we have a great little ring that we use as a home sleep test, and it works great. So
what does it do? What is it monitoring?
Yeah, so basically this ring, the patient would put on their finger, and there's an app that syncs on their phone. They go to sleep with it. Typically, we can get multiple nights of data with this as well, too. And so we're looking at obstructive sleep apnea, central sleep apnea, sleep stage disorders, and, heart rate, how many times you stop breathing, throughout the night as far as your average length of time versus the minimum and the maximum, number of seconds or sometimes minutes for people that they stop breathing. And oxygen desaturation. So a lot of data is gathered off of this. And these are FDA approved to diagnose sleep apnea for children 2 years old and up. So children and adults. We have a small version for the little ones. So.
We'll get back to the children topic because that's very important. I know some people that are watching told me they were going to tune in because of the little ones. But before we go there, I wanted to touch, because I saw that you brought, this book that we talked about in the past. When I don't breathe properly while I'm sleeping, let's say I'm a mouth breather, what starts to happen to me?
When you're not breathing through your nose, so your nose is filtering the air, it's humidifying it, you're producing nitric oxide, which is a vasodilator, which helps with our blood pressure, regulating that. And also you're getting more oxygen to the brain, especially the prefrontal cortex of the brain here, and as well as the bottom third of the lungs, that we really do not receive when we're breathing through our mouth. So overall, it's just a major boost to your body for longevity and health in general. The mouth breathing aspect, we're doing none of that, and not to mention we're increasing the levels of bad bacteria in our mouth as a dentist. So more likely to have gum disease and cavities. That's for children is major cause of cavities is mouth breathing for kids. So there's nothing good about mouth breathing, honestly. Even when you're exercising, unless you're sprinting, or something, but long-term endurance, you really want to be nasal breathing. So that's.
And there's correlation now, scientific correlation today, to a number of diseases that we can suffer from. And if we track back the root cause, start peeling that onion, we can trace it back to inappropriate breathing through sleeping, correct?
Oh, yes, absolutely. That's, if I can reference this book here, yes. This book is called Treat the Cause, Treat the Airway by Stephen Lambert, and this is written by a colleague of mine, and he's from New York. He's practiced in the same area of dental sleep medicine for a few decades, actually, and he wrote this phenomenal book, and he basically breaks down by organ system, and so it's very easy to flip through and just see cardiology. And there are over 170 medical conditions that are linked to obstructive sleep apnea, and he has all the studies basically backing that up, and so it's really nice, easy way to look at different systems and see what might be linked. But when you think about it like this, like getting back to what you were saying, referencing Matthew Walker, We can go days without eating or drinking anything. We can go days without exercise. We can go minutes without breathing. And if we even go 24 hours without sleeping, our body drastically starts to change. I mean, it's a major intoxication, and it's just, we will crash. Like, we cannot stay awake. We eventually pass out. So it's crucial. I mean, more things are going to happen internally, systemically to us. And so that night after night of not breathing properly drives up the inflammation in the body. And then, as we know, chronic inflammation leads to chronic disease. So really, if you're looking at the root cause, like this book references, treat the cause, treat the airway first, let's evaluate the airway and what's going on there, and then help to prevent the medical conditions that are linked with this, the cardiovascular, the diabetes, the cancers, the dementia, I mean, you name it. It's linked to practically everything. And to me, that just makes sense. So one thing that I would love to see change in our country is the fact that we start testing people earlier. Because we really don't do a good job of screening and testing for sleep breathing disorders. And from what I've learned, especially from a lot of physicians, is this kind of goes back to what you're taught in school. And I the same way from dental school, we weren't taught about any of this in dental school. And physicians have very little training on sleep in medical school. They will tell you that. And sleep really didn't become studied well and understood until about 50 years ago, when Stanford broke out and started studying it, and CPAP came out, and all of a sudden sleep apnea started appearing, and it was new. That hadn't been, really happening before. So it's a newer area, honestly, of medicine, and there's a lot not known about it. And so it's really been overlooked. The fact that, we can only go a few minutes without breathing, but yet no one even teaches us how to properly do it, that just doesn't make sense.